Scout is a 9-year-old male-neutered mixed Shih Tzu. I had the pleasure of meeting Scout in November of last year. A very sad case. He came in essentially not being able to walk. He had collapsed joints in his ankles and his wrists, where he was walking more like a duck. Mom had to carry him anywhere to move. He was pretty much a sedentary dog at the time because it was so uncomfortable for him to walk. His story began far before the presentation to AMC. He had been treated at a different facility. His symptoms started in June of 2018 when Mom noticed pretty suddenly that he became lethargic and he was reluctant to go up and down the stairs. She took him to her veterinarian, who prescribed some pain relievers and rest. Within a couple of weeks, his joints started to swell. He had swelling of his ankles and swelling of his elbows. Scout went on to be managed for several years on a variety of different pain medications. They tried him on one anti-inflammatory, a different anti-inflammatory, a joint supplement. At one point, the owner pursued acupuncture at a different facility. She also did pretty intensive laser therapy for his joints. They thought that he was dealing with arthritis. He had twice weekly laser therapy for about a month, and nothing really seemed to be helping. Scout, unfortunately, continued to deteriorate to the point, which is when I saw him, that his joints were completely collapsed and luxated. Thankfully, he saw a surgeon who had trained at the Animal Medical Center. And when she evaluated Scout, she saw that he likely would need orthotics to try to help him walk more normally, and that is when Scout was referred to us. And so from that initial symptoms in June of 2018 until the presentation to me at the Animal Medical Center in November of 2021, Scout didn't really have a definitive diagnosis for why his joints were collapsed. When we manipulated his joints, they were painful. They were actually luxating. He really did not have a great quality of life, which Mom was really worried about. Through a series of repeating some diagnostic tests to try to figure out what was the actual cause of Scout's joints being collapsed and not being able to walk like a normal dog. And what we discovered was that indeed he had an immune-mediated process similar to rheumatoid arthritis in people, where your immune system is attacking the cells in your joint and eroding them away. We knew we had to treat him for that disease. So I started Scout on an immunosuppressive agent, which allowed him to start feeling more like a normal dog. We also did casting of his legs, detailed measurements, photos, and videos that we sent to a specialized orthotics company that uses 3D printing to generate orthotics. So Scout was fitted with customized braces for both of his front legs. He was now on an immunosuppressive drug, and for the first time in years, we saw Scout's personality really shining. He was wagging his tail again. Mom described him as becoming playful again. He is now chasing squirrels. He'll even jump up and down when he gets excited. He is essentially returned to being a normal dog that is willing and able to walk in a normal position. One of the big challenges we had on presentation with Scout was that he had developed wounds, severe ulcers actually, on the bottom side of his wrist because he was putting weight on a part of his leg where he normally shouldn't put weight. So in addition to finding the diagnosis and fitting him with the orthotics, we had to heal these wounds. Mom is thankfully a nurse and was immensely dedicated, and for almost a year was doing serial bandage changes to keep up with the wounds that he had developed. And through the treatment of his immune-mediated disease, as well as fitting him with the orthotics, Scout was able to heal. In addition to the devices that we've made for his front feet, he is also collapsed in his ankles, and we're in the process right now of ordering custom orthotic devices for the ankles. So before we're done here, Scout will be walking with 4 customized boots that, even though will make him look different, his gait will be normalized and he'll be able to walk and play and run like a normal dog should be able to do. I am so delighted to be working at a hospital where we're able to help patients that were in as dire need as Scout was, be able to diagnose a problem that had been missed for several years, to be able to heal his wounds, restore his normal posture, restore his ability to walk and run and be a happy dog.